Let's talk toddler milestones. Now, milestones are what most kids can do by a specific age group. And by most, I mean 75% of them. Now, please understand that when it comes to milestones, a month can be a big difference. So I say this, 1 is not 2. 1.5 is not 2. 2.5 is not 2. 2 is 2, and even 2 and 2 is not 2. Milestones are broken down by 18 months, 2 years, 30 months, 3 years, and 4 years. Toddler month is like dog years. So a few months can be a big difference when it comes to a toddler. 4 milestones that they go over in each age group is social emotional, language communication, cognitive, which is learning, thinking, and problem solving, and movement and physical development. They're different for each one. Now, if you want a checklist, if you want additional information, if you want videos to support each one of that they talk about, you can go on the website for cdc.gov because they have everything. All the videos, all the checklists, it's broken down birth to 5 years old. Honestly, when it comes to the CDC milestones, these are the base and everyone uses them. It doesn't matter what reference that you're going to. These are the main milestones that everyone is using. And it's at the bottom. So if for whatever reason your little one is not meeting these milestones, that maybe they have lost the skills that they have previously learned from these milestones, that they're having any problems, this is your chance to act early, to share your concerns with your doctor, to make a plan, figure out what additional assistance your little one may need to meet those milestones. It may be therapy, it may be an intervention, it may be some extra activities, but whatever it is, please reach out to them. Now, if you've already had kids previously, maybe 5 years ago, or 10, or 20, please check your current milestones because they were updated in 2022. Milestones are just milestones. They are a base, so you can go above and beyond. If they are successful and they have met these milestones, you can move on. You can go to the next age group. You can continue working, but please revisit these. Don't just do them once and then like, oh, they did them and then you're done. No, you want to continue, make sure that these milestones can be achieved, not just with you. You want to make sure that these milestones can be done in different scenarios and with different people, because sometimes there's some things that they can do with you, with your coaching, or just with a little extra help and things like that. But no, you want to make sure that they can do this independently if it says that they should be doing it independently, or with assistance if it should be doing with assistance. But please revisit them. Now, when you print out your CDC checklist, please know that it is double-sided. It tells you, one, what most children should be doing at this age for each milestone group. Now, at the bottom, there's an area that talks about other things, other important things that you can share with your doctor. And it's just little open-ended questions that you should watch for with your child. If they're not meeting a milestone, some of the steps that you can take and things that you can do. On the back, there's about 12 tips and activities that parents can do to support our little ones so that they can learn and grow authentically. And again, please visit the website because there's additional videos, additional activities, additional trackers you can use for your little one. I'm going to go over quickly just a little kind of snapshot from each of the milestones for toddlers. So 18 months. Now, something that I look at that I really didn't remember seeing this is there is a little asterisk on 18 months. It's saying it's time for a developmental screening. So at 18 months, your child is due for a general developmental screening and an autism screening as recommended for all children by the American Academy of Pediatrics. Ask the doctor about your child's developmental screening, okay? I can remember this moment because I didn't know that this was something that all doctors recommended. I just got a call and it was alarming because my child had met all of their milestones at 18 months and I was confused because I hadn't looked at this specific chart and my doctor did not communicate that with me. I just got a phone call from some random screening place and yeah, it was alarming. So please, if you're a parent, this is something that can help you And when you get that call or something that you can talk with your doctor in advance so you know what's going on and you are not blindsided. 18 months, it looks like movement and social emotional are the dominant milestones. 30 months, there is an asterisk on this one too that's saying this one looks different than the other one. It's still saying it's time for a developmental screening at 30 months, but it's not including the autism on this one. It looks like language, communication, and movement and physical development are the dominant milestones. For 2 years, there is another asterisk, but this one is not for the general. This one is for an autism screening recommended at the year of 2. Again, it's language and movement as the dominant milestones. 3 years, there's no asterisks, there's no additional things, but language and communication is the dominant milestone here. It changes for age 4 because the social and emotional milestones dominate there. Some milestones may never be achieved if they are not given opportunities to practice those skills. I say that because for 4 years old, one of the things that they're working on is unbuttoning some buttons. Now, we live in South Florida and my kid wears t-shirts most of the time. So that meant that I needed to support him in that. I needed to provide him a way to unbutton buttons. So that meant I needed to search in the toys to make sure I put those out. Sensory board with buttons, the dress-up clothes with buttons, clothes with buttons. If I happen to find something, I may buy something with buttons that I might not have before, just because I know he needs to get the practice in. If you haven't already looked at your milestones, please do so. Print them out, hang them up, and make sure that you are giving your little ones opportunities to practice these skills, to make sure that they have met them. And if, for whatever reason, they have not met one or more, please act early.